Hi everyone, my name is Tonya Bowzer. I'm a Family Nurse Practitioner at the ReadyMED in Milford. Today we're going to talk about asthma. Asthma affects many people, whether you know someone that has asthma. It could be your family member, you yourself, a child, or really anybody. Asthma affects at least 25 million people in the United States, according to the National Institute of Health, 7 million of those being children. So what causes asthma? Asthma is caused by constriction of the lung lining. Asthma is a long-term lung disease that causes inflammation and narrowing of the airway. Common symptoms of asthma include coughing, wheezing, chest tightness, and shortness of breath. Although you have asthma doesn't mean that you always have those symptoms, and having those symptoms doesn't necessarily mean that you have asthma. To properly be diagnosed with asthma, you need to have lung function tests, a thorough medical history, and a thorough medical exam. So moving forward, if you are diagnosed with asthma, it's very easily treatable, although there is no cure for it. The biggest part of asthma is managing your symptoms. This includes exposure to environmental irritants, whether it be seasonal allergies or smoke exposure. Other things include controlling your symptoms. As an asthmatic, that is the key, controlling your asthma symptoms. This includes, again, controlling the environmental allergens if there is some, avoiding smoking, taking your inhaler if you do take an inhaler. And there are different forms of treatment for asthma. There is long-term treatment, which includes inhaled corticosteroids. Other treatment that is more long-term would be inhaled controller long-term beta-2 agonists, leukotriene modifiers, theophylline. There's various forms of injections. And as far as short-acting treatment, which we often call the rescue medication, those are called inhaled short-acting beta-2 agonists. And a good example of that would be ProAir, albuterol, and oftentimes asthmatics are aware of these medications. So moving forward, as an asthmatic, it doesn't always mean that you're going to have asthma symptoms. An adequate control of asthma means that your symptoms are adequately controlled, and when you have flares or exacerbations, as providers call it, you recognize those symptoms and treat them. As an asthmatic, it's important that you are aware of what's called an asthma action plan. This includes 3 zones, almost like a stoplight per se. You have the green zone, which means your peak flow, which is a measurement of your lung volume, which is also an important number that you should be aware about as an asthmatic. So as your peak flow, and in the green zone, your peak flow is about 80% of your best peak flow. How do you get to your best peak flow? When your symptoms are controlled as an asthmatic and you check your peak flow should be, and again, it ranges per person. So you want to document your best number when your symptoms are managed. So for the green zone, your peak flow is 80% of your best peak flow. This means your symptoms are well controlled. The next one would be the yellow zone. This normally is about 50 to 79% of your best peak flow. And there's different phases in the yellow zone. If you have symptoms, control the triggers. You also want to look at the medications that you use for these triggers. And then the red zone is normally 50% or less of your best peak flow. If you're in the red zone, you need to treat your symptoms fast. That means that you're having a flare, and if they're not getting better, you need to seek treatment. So moving forward, biggest take-home points regarding asthma would be educate yourself, know what asthma is, control your environmental exposures, seasonal allergies, smoking exposure, taking your medication. That's the biggest thing, taking your medication, whether it be an inhaled corticosteroid or your short-acting beta-2 agonist, as we talked about, the albuterol. And make sure if you're running low that you have these medications refilled. Oftentimes in urgent care, we see that patients have run out of their medications and then their asthma flares or they get an exacerbation of their symptoms. I guess the last point I would recommend taking home is being aware, having a good relationship with your primary care provider, whether it's a doctor or nurse practitioner, physician assistant, and make sure that you have a good relationship with them because they're handling your medical care. They know you best. And again, if you do happen to find yourself having an asthma flare or exacerbation, here at ReadyMED, especially here at ReadyMED in Milford, our team members, we're available for you. We're here to help you. So please don't hesitate to come on here and get some help.